Good morning, good afternoon, and good evening, wherever you are from. My name is Naveen Pathak. I am a clinical pharmacist currently working at Madan Mandari Academy of Health Sciences, Hetoda Hospital, the Department of Pharmacy and Clinical Pharmacology, located at Hetoda, Makwanpur, Nepal. So, in this sixth International Medical Congress of Izmir Democracy University, the topic for my presentation is multidisciplinary team approach and management of drug-related problems in chronic pain. So, chronic pain is a debilitating condition affecting about 30% of the population globally. Apart from this incidence, it also creates a huge toll on the personal and economic burden. Along with the personal and economic burden, it also affects the population diagnosed with chronic pain psychologically, thus creating issues of anxiety and sleep disorders too. So, literature underscores the need for an interdisciplinary treatment approach, which might include pharmacotherapy, psychotherapy, integrative treatments, and different invasive procedures. The causes of chronic pain include several diseases and several conditions, among which few are osteoarthritis, low back pain, fibromyalgia, nerve damage, autoimmune disorders, cancer, and injury. Chronic pain are often associated with other coexisting conditions which might further create or increase the distress in the pain mechanism. As a result and as a consequence, because of that, the patients are subjected to several medications such as non-steroidal anti-inflammatory drugs, opioidal drugs, and several other neuropathic drugs. As a result, this culmination of different treatment therapies can result into a condition known as drug-related problems. The Pharmaceutical Care Network Europe Association, which classifies the different domains and different categories for drug-related problems, defines the drug-related problems as an event or circumstance involving drug therapy that actually or potentially interferes with desired health outcomes. The management of chronic pain conditions often requires pain medications along with several adjuvant drugs. As a result, this creates a condition known as polypharmacy, and literature also shows that because of the existing polypharmacy conditions, it can result into several conditions such as drug-drug interactions, thereby increasing the chances of several drug reactions, adverse drug reactions, along with cases of non-adherence. This culmination of all conditions such as adverse drug reaction, drug-drug interaction, and non-adherence can be collectively called as drug-related problems. The consequences of DRP is quite huge. Literature shows that the consequences of DRPs is mainly linked to an increased cost of the population. Along with that, the populations diagnosed with chronic patients and who are the victim of drug-related problems also are associated with increased cases of emergency visits, longer hospital admissions, and additional visits, further exacerbating the condition as well as further increasing the cost of the patient. A recently published paper in 2023 in the Journal of Pain Research dealing with chronic pain patients also uh, highlights that despite there are several treatment therapies and several medicines used in chronic pain causing polypharmacy, the concept of polypharmacy should not be misled, such that the article also treats itself in such a way that polypharmacy is the rule rather than the exception among persons living with chronic pain. However, the article also underscores the need for providing more importance of close monitoring and regular medication review in this population. When it comes to identifying and management of drug-related problems, there are five different domains as per the PCNE classification, which consists of identifying whether the fact that the drugs are being provided or the therapy that is being provided is effective or not, and whether the treatment is safe or not, what are the potential causes for the drug related problems, and if any cases of drug related problems are identified, what are the potential or the probable intervention methods, along with the follow up of the patient. However, when it comes to identifying and management of DRPs, only a single healthcare professional cannot conduct it. Therefore, this underscores the need for a collective team, that is, for a multidisciplinary team approach, such that it can help to improve the patient quality of life. So, when it comes to multidisciplinary team approach, there is a collective need of prescribers, pharmacologists, clinical pharmacists, nurses, physical therapists, psychologists, and psychiatrists. Prescribers who can be involved in identifying whether the treatment is being adhered to standard treatment guidelines, adherence to the opioid stewardship in patients requiring opioid therapy, and to the concept of disprescribing. Pharmacologists, clinical pharmacists, and pharmacists, on the other hand, can provide key counseling points to the patients diagnosed with um, pa- chronic pain, as well as making sure of the idea that the drugs are being consumed in a best possible way, thus addressing any kind of adverse drug reactions and providing keynotes to the pharmacovigilance process. Nurses, on the other hand, can provide patient care and proper coordination to the patient. Physical therapists, psychologists, psychiatrists can provide physical rehabilitation, thus addressing the psychological needs of the patient too. When it comes to resource constraint setting, the role of MDT is much more important, such that they can be involved in providing pain education, awareing the people about the rational use of opioids and any kind of side effects associated with opioidal drugs. Similarly, they can be also involved in advocating the importance of highlighting the pain management issues to policymakers along with the evidence genesis and research work in the field of chronic pain. So, in a nutshell, in response to the strong call to action for policymakers, uh, in conclusion, should promote the idea of inclusiveness of resources, the availability of medicines such as opioidal drugs, the uh, strengthening the national treatment protocols, or adhering to the guidelines issued by several reputed associations, along with different educational tools to promote the idea of chronic pain in general. As a result, culmination of all these ideas in one will help in the management of chronic patients in minimizing the drug-related problems, thereby improving their quality of life. Thank you.